name is Nina Marino, and I'm the Director of the Office of Child and Family Services at the Department of Behavioral Health and Developmental Services. I would like to welcome you all to the 2021 Children's Mental Health Awareness Day celebration. You are the caregivers, advocates, parents, and policymakers who work every day to care for and improve the lives of children. The National Substance Abuse and Mental Health Services Administration sets aside the first Thursday in May to emphasize that positive mental health is essential for child's healthy development from birth through young adulthood. This day gives us the opportunity to renew our commitment to prevention of mental health issues before they develop in children, intervening as early as possible with children who might be at risk of adverse childhood events, traumatic stress, or other developmental factors. And we know that 1 out of every 5 children experiences a mental health issue in any given year, and 1 out of 10 of those children will have a severe mental health issue. But when treated, children and adolescents with mental health problems fare better at home, in school, and in their communities. And yet we know that 75 to 80% of children and adolescents in need of services do not receive them due to a myriad of factors. Those include things like stigma, lack of access, and difficulty navigating a complex and confusing service delivery system. One of our greatest challenges is the inconsistent array of services across the Commonwealth that is often based on zip code. We're working to address the access and consistency of services by creating a standardized continuum of quality behavioral health services for children and adolescents across the state. The Systems Transformation, Excellence and Performance in Virginia, or STEP VA, is one such initiative with our public mental health system that requires uniform access to critical services across the state, along with same-day access, primary care integration, and care navigation. We're also working closely with our Medicaid agency to create new services that Medicaid will pay for that are specifically targeted at keeping children in their homes and communities, which we know is best for families. And other areas of progress include improved access to crisis services through mobile crisis, which allows us to come to wherever the family would like at the frequency and schedule to meet the family's needs in order to intervene in crisis situations earlier on. We're working on evidence-based practices for treatment, which will increase the involvement of families and children in the treatment process by giving the families more voice and choice, and increasing things like family and youth peer support partners in treatment. And over the past couple of years, we've partnered with pediatricians and family practice doctors from across the state to enhance the training that they receive in behavioral health issues, and also to provide them with more access to child and adolescent psychiatrists, licensed mental health behavioral professionals, and care navigators, all to assist the doctors and the families and helping everyone where they feel most comfortable, which is often first with their doctor. So we know this year's created additional mental health challenges for youth and families due to the COVID-19 pandemic. And we know that families have struggled with childcare, virtual schooling, personal safety with the virus, economic insecurity, and the continued demands of work and family life. And so with that in mind, we have chosen resilience in the times of adversity and uncertainty as our theme for this year's Children's Mental Health Awareness Day recognition and celebration. Unfortunately, we're still unable to host face-to-face events, so we decided to develop a series of 5 videos that will reflect our theme based on feedback we received directly from families last year on what they would like to see for Children's Mental Health Awareness Day. So here's a sample of the topics for you guys to enjoy. Nurturing family resilience through support and Formed Families Forward and the National Alliance of Mental Illness, or NAMI. Coping with uncertainty using mindfulness and yoga with Project Yoga of Richmond. Resilience, promoting the mental health of youth and young adults, presented by Youth Move at NAMI. Build your resilience in the face of crisis, presented by family and youth support partners and behavioral health professionals at Middle Peninsula Northern Neck CSB. And the impact of racial trauma and resilience, creating solutions, presented with Voices for Virginia's Children, Greater Richmond Scan, and Safe Haven Space. So we hope that you will find these videos helpful with practical strategies and solutions. Please share them as you would like and watch them at your convenience. And as always, we will continue to partner together to help our young people and families have the best opportunity for success and abundance in their lives. Thank you.
Hello, everyone. Welcome to this panel on the impact of trauma and resilience, creating solutions for children and families in recognition of Children's Mental Health Awareness Month. As the pandemic continues to exacerbate hardships for families along lines of racial and ethnic identities and more, much must be done to address the impact of racial and historical trauma on the mental health and well-being of Virginia's children, youth, and communities collectively. We're going to first just open up this panel by allowing everyone to just introduce yourselves. This will kind of be informal, so it's a go with the flow kind of structure. But we're all just going to go around and introduce ourselves and give you some background on what brings us to this work when it comes to this topic. We believe personal and lived experiences are important as they inform our professional experiences. So I'll start off. My name is Chloe Edwards. I identify as a Black woman, which is my primary lens that I use in a lot of my work. I grew up in poverty, but lived in a middle-class neighborhood. That was a strong belief of my mother so that we could get good access to an education. I witnessed a lot of adversity in my childhood, living with a parent with addiction, struggling with incarceration and mental illness, as well as child abuse. When I was a little older, I ran away from home at about the age of 12 and was told by a white male police officer that he used to be rebellious just like me, and I was told to be quiet. Eventually, I did go into kinship foster care, and instead of being quiet, I decided to speak up and go into children's advocacy and activism, which brings me to my role as a policy analyst at Voices, specializing in the social determinants of health, including health and wellness, trauma, equity, and family economic security. I also lead our Racial Truth and Reconciliation Virginia campaign. And I'll just pass the mic to any of my other colleagues who kind of want to chime in on what brings them to this work.
Sure, I'll go ahead. Hi, everyone. My name is Egette Indelele, and I am a student at George Mason University. I identified as a Black African-American. I've also been through many adversity, including being a refugee and coming to a new world and learning a new language. I came here when I was 8 years old, and before we came to America, my family had survived a genocide, and they were living in a refugee camp, from different refugee camp to other refugee camps for over 30 years. So when we came to the United States, I've experienced the generational trauma that my family went through, and it was just put on the kids and the children of their kids. So growing up, it was a bit hard to express my feelings, emotion. And when I was in high school, it just became a bit difficult to express myself mentally, physically, emotionally. And that's where a lot of my behaviors, as you can say, occurred, just because I didn't know how to process it or put it into words. But then when I came to college, that's when I realized that it wasn't just me. I met a lot of friends who had the same background as me. So a refugee coming from a family who experienced many traumatic experiences and genocides. And having that group of friends made me feel welcomed and heard, especially with everything that I went through in the past. So with my organization is called Safe Haven Space, and we provide mental health services and education to refugees and immigrants. I specifically got into that because of the group of friends. They showed me a way to provide a safe space, but also bringing in professionals to support and help them in any way that they want to be helped. So yeah, that's me.
And hello, everyone. I'm Amanda Lynch, and I am a trauma-informed specialist at Greater Richmond SCAN. I am originally from Glen Allen, Virginia. I grew up in a very, very predominantly white neighborhood and attended predominantly white schools until I went to Henrico High School for Center for the Arts. I was a theater kid. I would say my experiences in earliest parts of my education probably are what informs the work that I do in terms of racism being trauma. It was a very traumatic experience, to say the least. Being the only brown face in the gifted program, constantly having things that I believed and said called into question in school. But I would say that my family and my grandparents in particular, and my dad, really reaffirmed me in a lot of ways. If I said I wanted to touch the moon, they would have helped me build a space station. So I will say that my inner resilience most certainly comes from my family, who mostly all live on one street in Hanover and then in Short Pump, Virginia. In terms of my work with trauma-informed practices, shortly after graduating from Mary Baldwin College, I thought I wanted to go into housing equality. I had worked at Habitat for Humanity in Stanton, Virginia as an undergrad, and also spent my school breaks going all over the country, helping to build homes through Habitat. But found that really wasn't just a good fit for me at Richmond Habitat. And so I went into being a teacher. I spent almost 20 years working in the public school system as a special education teacher first. And then I moved and transitioned into being a gifted resource teacher. And then at the tail end of my career in public education, worked as a behavior specialist. I felt like the work that I was doing as a behavior specialist was very antiquated. It was a lot of time really just analyzing student behavior, collecting data, and then making recommendations to the classroom teacher about how students could be more compliant. When really the root of the problem in many cases was trauma and adverse childhood experiences. And I sort of stumbled into that work 15 years ago. Last month, my best friend and her father were murdered. And so I sort of shifted my career really to try to understand what happened. The person who killed her was a family member who I'd watched grow up. He was one of her cousins. And during the trial, they talked about just some traumas that he'd experienced as a child through divorce, through moving, through housing instability and those kinds of things. And so I think that experience, more than anything else, really reshaped the way that I began to work with students. I'm also a yoga and meditation teacher, and so I'm very passionate about introducing mindfulness, yoga, and meditation to communities of color as a way to reduce toxic stress. And so with all of those personal and professional experiences, I come to you all today, also as a Black woman who's very invested in my community. I'm also a mom. I have 4 children ranging in age from 22 to 4. And so that's an experience in itself. My son came to me through sort of an informal kinship process. And then, I've also watched my husband stumble with addiction and also with mental health issues. And so, I'm very excited to be here to talk to you all today.
Thank you. So lots of themes around kind of what brings us to this work and our desire to make a big impact in this field. Voices for Virginia's Children is also home to the Racial Truth and Reconciliation Virginia campaign. And what we look at is the impacts of cultural, historical, and racial trauma, how that plays a role in positive, and negative health outcomes, but we recognize that the cure to that is resilience to create positive experiences in the community. And so I wanted to go through kind of just some examples of cultural and historical and racial trauma. You all are welcome to chime in yourselves, but just looking at the state level and how these traumas are perpetuated systemically often impacts collective communities, whether that's the Black community or immigrant populations or other communities. And when we look throughout history, it really starts in the 1600s to 1800s with slavery. and even post-slavery with laws like Black codes, convict leasings, lynchings, beatings, threats to life and property, etc. So when we look at how this impacts children, particularly, we know that there's a mental health impact of racism, a cultural impact of racism. There's also a systemic impact of racism. So it literally occurs at the individual, institutional, and systemic level. But going through cultural and historical trauma, this can be traumas. Slavery is an example of that. Racial trauma really looks at the day-to-day individual experience that individuals cope with of racism. It could be affiliated with suspicion of others, an additional sensitivity to threat. If there's adaptive responses that are transmitted across cultures to cope with racism. So any other things that folks want to comment when it comes to this topic and how it can impact children at the community level, but also the systemic level?
And so I think for me, just looking at my work in the community, oftentimes my families that I've served, certainly in Richmond City, have been caught in the cycle of generational poverty. Many of them live in the same, housing community that their mom or grandmother may live in, and all of those things go back to redlining, with certainly Jim Crow, and then again are connected to slavery. And then I think also when we look at just the economic and educational structures that are in place, they are not easy to break through. I know for me, we've been doing a lot of like ancestral deep diving within my family. And so looking at my grandmother's grandmother who lived on a plantation in Powhatan County and had children with the owner of that plantation, but also with her husband. And even noticing some distinctions between those two branches of families, some disconnect there. Many of those things can be traced back there. I talk a lot to community organizations about the ways that we manifest and hold on to racist encounters in our bodies, whether it's through having a low-grade fever, whether it's high blood pressure, anxiety, all of those things which can turn into things like high blood pressure or cardiovascular disease. And so, and then getting into epigenetics with passing those health conditions down to the next branch in your family tree. So yeah, I think most certainly that there is a cross-generational component to racism, not just from the systematic pieces that we see with educational systems or economic systems, but also with those personal, everyday microaggressions that happen and things that show up for us when we're experiencing those things.
So let's kind of look at the macro level first, and then we can go into some of the community level experiences. But I named slavery as an example, but we also have witnessed the separation of children and families at the border. And so when we talk about the impact of that, we know that separation of children from families is an adversity on its own. There's experiment, Kaiser Permanente experiment on childhood trauma and adversity that talks about how this is affiliated with negative health outcomes. And then, like Amanda said, we can go further into epigenetics a bit later, but in October 2020, the New York Times reported that more than 5,500 children in total had been separated from their parents at the United States border under the Trump administration. Some of the families who have been identified decided that their children would be safer in the United States than in their home countries, and elected for the children to stay with friends or family or members who agreed to sponsor them. While many families did elect to leave their children with friends and families, none of them had made these journeys with the intention of giving up their children, and most were forced by the family separation policies to make impossible choices. Yeah, you have a lot of background in what leads people to come to the United States, many life or death situations.
Yeah, mainly either the environment or also the violence that's going on in their home country. It's every time parents or family leaves the place that they're coming from is because of the environment and also the violence that's going on. And what's always on their mind, specifically for me, was my family were looking to get away from the genocide that was going on, and making sure that we have a better life. But with the recent or through the I'm blanking through the administration, it's difficult to have parents or have children be separated from their parents, especially having grown up with them. And, you know, whether a child grew up with a family or two parents or in a one home parent really matters, and it affects their mental well-being. So with that being said, it's really important that we do focus on the mental well-being of those children who are coming into the United States without families or I'm sorry, I'm blanking. I don't know what's going on today.
Mm-hmm. And in your early memories here in the United States, were there any supports that you found were key to surviving and thriving when your family first immigrated to the United States?
Yeah, it was mainly the support that we had here in America. The first time we came to America, it was difficult because of the language barrier, and just the things that we had heard about America. It wasn't so good. It wasn't good that we were able to walk outside freely or talk to people freely. It was more of like, yeah, we came here, we need to do what we got to do and either go back home or whatever that needs to be done. But we found that the people from our place, so like I'm Burundian, and we had a community of Burundians that were in Roanoke. So they actually helped us feel welcomed and also support us with like anything we needed, whether it was school, jobs. One of the biggest barrier was language. So with that being said, languages, what is going on? I'll stop right there.
I know what you mean. So there's been a trend that we've seen places across the state of translation, especially with COVID coming, translation service issues. It was more of a sense of urgency, of course, during the pandemic, but these are issues that we've seen in general. And so it really comes down to recruiting or creating incentives for a culturally diverse workforce. But I also like the idea of that peer model where you can have that connection to cultural supports. Amanda, you talked about the redlining, which was a practice that occurred in the 1930s. The government graded neighborhoods in over 239 cities and color-coded them. Green for best and red was an example of what was hazardous. In large parts, the residents were graded because of their racial or ethnic demographics. Assets nearby also played a role in what grade or score that neighborhood received. And what this did was it really pushed out lower income minority residents from gaining access to equity in housing. And long term, today we still see that in those neighborhoods that were zoned, they are still neighborhoods that are struggling economically. But when we break this apart even more, we go into the Indigenous Trail of Tears and all of these cultural, historical, racial traumas that have impacted children and families from an intersectional lens. We also need to talk about the racism that has existed in our own mental health system here in Virginia. The Central State Hospital has a digital library, and they have an archives project that produced digitized files of the Central State Hospital. This was previously an all-Black asylum. They were pushed into this model because of fear of Black madness and segregationist attitudes. the desire to separate the Black patients from the white ones. In 1869, the asylum committed 123 supposedly mental ill patients, and 100 were poor or homeless, had nowhere else to go. Many of them were transferred from other institutions. This hospital still exists today. The previous name was the Central Lunatic Asylum, and now known, like I said, Central State Hospital. The documents and photos recorded from that project shed light on the painful history of the hospital. Patients lived in crowded and unsanitary conditions. They were subject to treatment, including experimental surgeries and forced sterilization. Doctors believed Black sanity depended on hard labor, so patients were required to work, tending its large farm or doing chores, which was another form of enslavement. Patients could have been hospitalized for manias brought on by religious excitement or freedom. Women were committed because they were upset about their husband or because of intense menstrual pain. The issues really exceeded mental health, and those who were subject to this treatment faced various forms of trauma, ranging from poverty to racism. They could be committed by whites or others in the community to the asylum, and those who died were buried in unmarked graves, and many of them subject to grave robbers or local medical colleges. And an example of this would be the 2019 Smithsonian study, which uncovered the Virginia Commonwealth University participation in this form of medical experimentation in science for their medical students. So then Amanda talked about interracial trauma or epigenetics and how this trauma is passed down, and epigenetics talks about how trauma can literally leave a chemical mark on a person's genes when this is passed down to other generations. Anyone kind of witnessed this trauma in their communities? Dr. Joy DeGruy talks about post-traumatic slave syndrome, which multi-generational trauma and an absence of opportunity equates to post-traumatic slave syndrome. This leads to other behaviors such as a lack of self-esteem, propensity for anger or outbursts, or internalized racism, like we've seen in the Brown versus Board of Education doll experiment. Egette, you talk a lot as well about kind of the denormalization of mental health in your communities, but have there been other examples of how you've seen this trauma passed down generationally?
I'll say, Chloe, that when I was pregnant with my now almost 7-year-old, we did genetics. Excuse me, we did genetics testing because I was of an advanced maternal age at the ripe age of 35, and so we mapped out different health conditions that existed in my family and also on my husband's. But we also looked at trauma and mental health that existed on each side of that family. Of our families, and there are clear connections with untreated trauma, in particular my husband's family, and noticing some, some similar patterns. And so, for example, if a parent may struggle with a substance use disorder, which goes untreated, the child may experience neglect or abuse or just witnessing domestic violence or things like that. And without, intervention or having a mentor or, something along those lines, may develop some of those unhealthy coping mechanisms themselves. I see that a lot in my work with families at Greater Richmond SCAN as well, for my parents who may be extremely stressed out. And so they may not speak as mindfully to their children or correct them in a very mindful way because it's simply not something that they themselves have experienced. And they may or may not have healthy coping mechanisms for their own stress. And so I think just in the same way that trauma can go from one generation, so can resilience. And so whereas for you, Chloe, your experiences have shaped who you are, but it's also helped you to be an amazingly resilient advocate for other children who may be going through those same experiences. And I think the difference for you and many other children is just having that one or two adults or caretakers or teachers that really invest in you and show you that there is more than your trauma. And so just because someone has adverse childhood experiences or, mom smoked while she was pregnant and passed those things down to you doesn't mean that's a trap for you. There's certainly ways to overcome trauma and to become resilient and a functioning member of society.
Mm-hmm. I definitely agree with you, Amanda. From my experience, my family been through many adversities, such as surviving genocide, and what I've seen is the PTSD that has come from the experience that that verse that they came through, and on my end, I've experienced child abuse, and it's really interesting to see how my siblings and I are like completely different. Whereas I grew up with my grandparents' support system, a group of family who focused on me. So I'm the oldest child, and my siblings, after they were born, it was really interesting to see how it was a change. So I'm a straight A student, and then my siblings on the other side have behavior issues, and it's really interesting to see how the support system for like one child changes to the other student or the other children. So I think really like support in a child's early stage really do help how they grow up. Because if I didn't have the support that I needed or the support that I had growing up, I wouldn't know where I would be. And that's something that I'm really grateful all the time, and that I tell my friends and family and support system that were there for me. Because looking back, it's just, if I didn't have that support system, I really wouldn't know where I'd be. So I definitely agree.
I talk a lot, like within my own family, just about the difference in the way that someone who is raised in survival versus someone who's raised in love. And you can certainly be in a survival mode, but still show empathy, compassion, and raise your family in love. So I'm not saying that way, but it's just clear, like, sometimes kids who have to develop those social, emotional life lessons for themselves without guidance stumble a little bit. So, when I'm correcting my children and I can feel myself getting angry, I will say, Mom is having big feelings. I'm feeling, and I will describe to them, and I'm describing it to them, but I'm also trying to describe it to myself, right? So I'm also trying to like process for myself that I'm about to flip my lid in here because y'all won't go to sleep. And so, I'm talking to them about what that feels like inside of me when they're not listening or when they're not following through. And they in turn do the same thing. My 4-year-old will come up here and say, I'm so angry, instead of just rolling all over the floor. And so we'll talk about like, why are you feeling that way? What does that feel like in your body? Another thing for us is having a bubblegum brain versus having a big brain instead of a brick brain. So believing that you can do something even if you can't do it yet. And sort of verbalizing those lessons to them, because I want to model for them what I expect for them. Instead of like screaming and yelling because I'm frustrated, or spanking my kids because I'm angry that they're doing something, trying to just draw upon healthier things to do. And it's not always easy, and every day is not going to be a win, or every moment might not be a win, but really just trying to change some of those generational things that I don't want to see them fall into.
Yeah.
I think it's just like a room like this is just beautiful because there's just so many things. When I think of my childhood that I've had to overcome, and my mom, she did say, an apology to an extension, but said, I was in survival mode. And I think that's why all of these intersectional hindrances, such as like economic security, which produces economic trauma, or inequitable access to food, racism in schools, the push out of minority communities in the United States, and how that all intersects systemically. It of course doesn't it doesn't testify to the future that these communities are capable of having. That we've overcome so much, decades and decades of trauma. But I think why that one permanent, caring, stable adult is so important, because it reflects like the resources that can come from the community. It reflects cultural resources if you're connected to someone within your culture. I've had a mentor that served and kind of uplifted me to get me to that next point to be successful. And so those are all of the things that have been very memorable, and what was able to serve as a support in getting to that, into overcoming all of those odds. I guess that kind of brings us to, with all of these things that exist, barriers to building trust in communities, from the neighborhood level perspective when it comes to challenges and solutions. We have a lot of great state policies that I could, of course, talk about, but a huge theme that has come out of the pandemic is neighborhood solutions like community asset-based development, or that neighborhood resource center, hosting diaper banks and stipends for transportation, or to pay our utility, et cetera. So when people don't have what they need, you're not as worried about mental health. So are there any examples of that with your organizations, of how you all have played in kind of an intervention role? Egette, I know you too have been doing a lot of mental health resources during the pandemic.
I can go ahead. Yeah, so during this time, we've honestly been promoting more of mental health awareness and well-being on social media, just because this pandemic has increased anxiety, especially since, there's the COVID and people are scared of whether they're getting it or not. And just being away from their families and their friends, that has also increased anxiety. So we've provided ways to sit with themselves and what they're feeling, and also provided tips on how to handle their mental well-being, or how to take time for themselves. Right now, we're also working to start our pilot program, where we provide the services, but also teach how to mental health. So how to take care of yourself, and how to look at yourself and see whether you need to take a step back from whatever is going on to better help yourself. And that specifically will be for refugees and immigrants. But during the pandemic, we've just been promoting self-awareness, self-care, and just making sure that people are talking to one another, and just not staying to themselves. So.
One follow-up question of, when it comes to accessing mental health services, there are some barriers. I know you've personally experienced 40 quarters, but there are definite barriers for undocumented population. Have you ever come across having to overcome those with the populations you're serving? I know you all work on pro bono counselors, because of barriers like that, where people do not have access to health insurance at all to pay for mental health.
Mm-hmm. Yeah, and it's also always hard to like find therapists who are culturally competent. So that's why we're here. We help our refugees and immigrant community have access to those therapists who know their background, who have worked with individuals that had similar problems or similar things going on in their lives. But in general, Chloe, do you mind repeating your question again?
You were talking about culturally competent therapists.
Mm-hmm.
And we were talking about access to services for undocumented populations. Many are not able to get access to Medicaid unless they're pregnant or have a child.
Mm-hmm.
And that would be a woman specifically.
Mm-hmm.
some populations that are legally here can have access to services depending upon the policy.
Yeah, and how long they've been here.
Yeah.
Mhm.
So Amanda, have there been any ways that you all have been more there for the population that SCAN serves, which is mostly children,
Yeah,
families?
both children and families. I think my husband and I, Marcus and I, were talking this morning, and he said a quote that I'm gonna stick with me, that a war is fought on all fronts. And so I think in one regard is continuing to do like lobbying and advocacy work, most certainly to our state legislator for improved funding. Also pivoting virtually to providing therapeutic supports to families and young people who participate in our family service program. So for parents who may be in danger of losing custody of their kids, for example, we have a 20-week program that is normally in person, but of course that flipped virtually. Still also working within our schools. We have a team at SCAN that's embedded in Richmond Public Schools, and also a colleague who is Michael County. And so continuing to work with staff and students. I do a lot of community training, but I also work with all of the Boys and Girls Clubs in Richmond and then the club in Petersburg on trauma responsive practices and cultural responsiveness, what trauma looks like, what race and class look like, and how those things inform decisions. And so, yeah, I think we've just tried to hit it on all fronts and just be as flexible as we possibly could, considering the circumstances. We are looking at doing some more in-person work this summer, in particular with our teens. Boys and Girls Club has a new facility, that's not facility, but a new center that's opening just in front of Creighton Court mid-summer. And so we're really excited about that and bringing back our kids grades 5 to 12 and engaging our alumni. I am expecting, I think one of you mentioned like an uptick in mental health crisis situation. So I'm fully expecting many of our students to come back having not had the best time out of school. And so just being able to fill in those gaps for kids as well, and maybe providing some on-site therapeutic supports for kids in our out of school time programs is something that we're also looking at doing.
Mm-hmm. A lot of that intersects with what we have going on at the state level. We're essentially in two pandemics right now, which is COVID-19, but we also have racism as a public health crisis. So there's been a lot of social justice themes too this summer with Black Lives Matter and the police shootings occurring. There were 2 recent deaths, and the shooting of Adam Toledo, who was 13 years old and fatally shot on March 29th, as well as Micaiah Bryant, who was 16 years old and fatally shot on the same day of the George Floyd verdict, ironically. Here in Richmond, Virginia, Marcus Davis Peters was also fatally shot in 2020, which led to the Marcus Alert, which would help decriminalize, destigmatize mental health crises in Virginia through diversion from law enforcement. So through mobile crisis stabilization or response teams in order to intervene in a crisis. It'd be a paired law enforcement in some circumstances with a mental health professional. So this ideally, the work group has been working on that. And the other problem is that when someone is in a mental health crisis, for example, oftentimes the only number there is to call is 911. And so we need to beef up our community level resources, some of which you mentioned, Amanda, and some of which you mentioned, Egette, so that we have a culturally diverse workforce and a well-funded workforce in order to be able to handle all of the mental health needs of those within our community. This year specifically, so there was the 988 call center and hotline that Senator Jeremy McPike worked on. So there will be some infrastructure in order to create that, which would serve as a centralized place for 911 calls. But this General Assembly, there were also steps to implement early childhood mental health consultations that would help your 0 to 5 population. There have been circumstances where law enforcement has been called because of a crisis that someone young has been in. And so just remembering that continuum of care at every age across the lifetime that children and individuals experience will help us respond at the community level to what the community needs, meet them where they are. When it comes to cultural diversification in the workforce, this has been a huge theme for the past 3 years. There were 3 budget items to restore funding to the behavioral health loan repayment program. This was unallocated after the 2020 budget because of the pandemic. So the idea is that this will incentivize professionals to work in the mental health field and hopefully diversify the workforce to reflect the population served. And then there's this idea of community-based mental health. And so when it comes to community-based mental health, there were investments made in including support staff of $49 million to hire additional student support staff. This would include social workers, nurses, and psychologists, as well as school-based mental health Medicaid reimbursement for that through Senator Donovan's bill. So those are a couple of pieces happening at the state level. There was also a critical step for Virginia, which was recognizing racism as a public health crisis in Virginia. And this resolution, although symbolic, makes us the first in the South, and it comes with some clear calls such as prioritizing community engagement, investing in the Virginia Department of Health's equity department in order to examine biases in health and create a category of definitions, implicit bias trainings. But the key is the commission to examine inequity and racial bias in law, which would make some policy recommendations. Which brings us to the next point, advocacy, action, and justice. All of you all have participated in advocacy at some point. And so when we're thinking about the challenges that children and families are facing, especially if it's at a disparity or disproportionately impacting a population, there's a clear call for justice and responding by raising our voice and uplifting democracy. So what have your experiences been with that? And do you have any suggestions or kind of gems that you want to leave with folks?
I think for me, my advocacy work really with like going to lobby or things like that really started with me taking a group of students from Armstrong to lobby in DC to Bobby Scott to talk about like improvements they wanted to see in their community. And so I would just say, like in terms of gems, everyone has a voice. We may all use it differently. For me, that might look like writing because I'm also a writer. For Chloe, it might look like working on legislation. And for Egette, it might look like working in her community with refugees who may share her experience. And so to just find something that you're passionate about, look at your community and see if there are ways that you can step in and help. I've sort of fallen back a little bit with my advocacy work to support my daughter, Ava, who's 15 and is doing her own advocacy work with trying to create more diverse spaces in the arts. But I think she learned those lessons from watching me and my mom and grandparents and our own personal calls to action. And so never think that your voice doesn't matter or that one person can make a difference, because I believe we're all called here to improve our communities, and we all have gifts to bring to the table.
Well said.
My advocacy started just in high school when I wanted to bring just mental health awareness to the refugee communities. The communities or the community that I'm in focus on stigmatizing mental health. And with my experience and just everything that had happened mentally, physically, emotionally, I just wanted to bring the educational aspect of mental health and help that community realize that mental health, or you don't have to seek a therapist because something's wrong with you, you could talk to them just because you want to talk to them, or just because you might need guidance on something, or you're having problems communicating with a friend or a family member. So that's when my advocacy started. But just to give advice to anyone who might want to start, just like Amanda said, just realize what your passion is, and your passion will do the work. But also take time for yourself too. I know once you're passionate about something, it's really hard to pause and just have time to yourself. So try to balance the passion and your mental well-being. So yeah.
Similarly, I got into advocacy when I was fresh out of high school. I had met a mentor and told her my story, and she had engaged me in child welfare advocacy. I initially started off with foster care advocacy, but then I got into social justice advocacy when experiencing racism on campus. So it wasn't quite legislative, but it was definitely self-advocacy on campus, and working with the Black Student Alliance, et cetera. And then upon getting older, your lenses that guide you will definitely change. It transitioned into trauma-informed care advocacy, and now social justice and health advocacy. So, but I do think the primary lens that has guided all of my work is my intersectional identity as a Black woman. But I will say, you have a voice, use it, and democracy doesn't work when we don't speak up. And depending upon your passion, you may have some naysayers, and my greatest experience was just doing it anyway, and not caring what people had to say, not caring about that imposter syndrome voice telling me that I couldn't do it, and just doing it anyway. So that would be my greatest gem to leave with you all. And what are some ways that folks can contact you all? I'll start off first with saying my email is Chloe, CHLOE, @vakids.org. You can follow at VA Kids on social media, or at Racial Truth on social media. And if there's also ways to get involved, ladies, let folks know. You can get involved with our organization by visiting vakids.org and connecting with the Racial Truth and Reconciliation Virginia campaign, or all of Voices work, which is mental health, child welfare, early childhood education, and health.
Yeah. You can reach me at EINDELEL@gmu.edu, or you can also visit our page, safehavenspace.com. And if you're looking in a way to get involved with what we're doing in providing mental health services to refugees, you can visit our Instagram at safehaven_VA and send us a DM or email us, and we'll figure out what you can do.
And then for me, the easiest way to reach me is probably through Greater Richmond Scan. My email address there is alynch@grscan.com.
Well, thank you, ladies, for joining us today. And we look forward to connecting and hope you all will get in touch. You can, again, visit vakids.org. This is also during Resilience Week, so you'll be able to visit our Resilience Week events, which SCAN is hosting. So it's a small world. You can visit their website too for Resilience Week events. We're connected. Thank you.
Thank you.
Good to see you all.
Bye.